Welcome to the Quad Matrix Q&A. The question we're going to answer today is why are there four rings in the quad matrix system? And the first thing you'll notice is that there are two different pairs of rings, one pair being the blue pair, which is the universal, and the other pair being the yellow pair, which is the large. And the only difference between the universal and the large, or the blue and the yellow, is simply the size or the height of the pads. So the yellow is a bit taller than the blue universals, and so the yellow would be indicated for taller clinical crown situations, such as in aging adults with longer clinical crowns or just individuals with longer clinical crowns. It doesn't necessarily mean that you use the yellow for molars only and the blue for the bicuspid area only, because I run into oftentimes that I use the universal for almost everything, and this is reserved for teeth with much taller clinical crowns. And so the other thing that you'll notice about these two different sets is that each set has a black indicator on the top of the pad, on one of the pads, and that pad is different for the two rings. And the reason for that indicator is to show you which side is different. So if you flip these rings over, one of the very unique qualities of the quad matrix system is that the ring pads are not identical. They are no longer universal in the sense that they are the same and you could put them anywhere. We have engineered two different pads to incorporate the pads in different embrasure spaces in the mouth and maximize matrix band and matrix ring efficiency. And so that indicator mark is going to tell you which side is what we call the driver tip. And the driver tip is designed to engage the lingual or palatal portion of the teeth. And you can see that our embrasures on the buccal and the lingual of teeth are very different. So they're much flatter on the buccal side, and they're more V-shaped or deeper on the palatal or lingual side. And that's what this system is designed to do. And so one side would go on the patient's upper left and upper or lower right, and the other side would go on the patient's upper right and lower left. And there is an indicator diagram that comes with these kits that is a quick reference guide for you or your assistants to determine which ring is correct for the correct situation.